to ask, and usually I do webinars and then ask people if they have any questions, but today I thought I'd just do a question and answer period just to see if people have questions about chiropractic, about shockwave, laser, these types of treatments that we do here in the clinic. So again, this is your chance to ask questions. I'm just going to move over my camera here on Instagram. You can type them in the comments. You can give me a thumbs up if just to let me know you're there, or a hello. And here on YouTube, you can ask questions right here in the chat. So ask questions here. Today I did a video on laser and shockwave, and that was good because people often have questions about laser and shockwave. They want to know how laser and shockwave can help them, and I was talking about the difference between the two, laser being light therapy, shockwave being sound therapy that goes into the tissue to heal the tissue. So when we have soft tissue injuries like sprains and strains, maybe somebody's has a tear or they've got trauma to the joint, laser and shockwave can be very beneficial. They're different. Shockwave being sound therapy, it sends sound waves into the body to heal the tissue, and laser being light therapy that goes into the body, and that light stimulates the mitochondria. So two different things, light therapy for the laser and acoustic waves for the shockwave. And actually the shockwave was developed as lithotripsy years ago, when they used to do operations to take out gallstones or kidney stones. Then they developed shockwave technology to blast out the kidney and the gallstones so you could pass them through, break them into parts. And that was how shockwave was initially founded. And then it was modified for joint therapy and soft tissues, and that's what we have today. So really fascinating technology, both the shockwave and the laser. We see a lot of patients in the clinic for a variety of different health concerns. For example, today, people with upper neck misalignments in the cervical causing headaches and neck pain. We had a patient that hurt his low back and has sciatica, so pain going down his leg. We've had patients this week with concussion-like symptoms, so we've seen that. People with sprains and strains to their Achilles tendon, their foot, something called plantar fasciitis. You might have heard of that, plantar fascia being inflamed and swollen. We had a lady with bursitis in her hip, and we actually treated that with chiropractic adjustments as well as using laser therapy for the bursa to help heal the bursitis. We do orthotics as well in the clinic, so just to help with cushioning of the feet, correcting the arches, helping with problems with the heel and the long arch of the foot, as well as the transverse arch, the arch that goes across the foot. So we do orthotics for that. We see people from that have been in car accidents like whiplash, and people that have been injured in sports injuries like rotator cuff syndrome in the shoulder, separated AC joints. We see people with golfer's elbow and tennis elbow, very common, especially right now. People are starting to golf more. The weather's getting nicer. And, especially when you're taking a golf swing and you hit the ground, it kind of shocks the elbow. I think a lot of golfer's elbow comes from that impact, that sudden stop or the sudden resistance from the ground when you're hitting your ball. So that can happen also like tennis players, when they're swinging, doing the backhand and extending their arm, that can cause tennis elbow as well. So we do see tennis elbow, golfer's elbow being on the inside part of the elbow and tennis elbow being on the outside. That's the difference between the two. Let's see, what else have we seen in the clinic? Carpal tunnel, that's the nerve going right through the wrist area, right through here. Carpal tunnel syndrome. We've seen people with knee sprains. One gentleman had a medial meniscus injury, which is the cartilage on the inside part of the knee. He doesn't know how he caused the injury, but just one day he had pain on the inside part of the knee, had all the testing done. That came back negative. But basically what was happening was he had traumatized the cartilage and the tissue in the inside part of the joint, caused inflammation. There was actually a little bit of blood in the joint too. And it just got very swollen. It was hard to walk on it, especially on uneven surfaces, and that was causing a lot of pain for him. We were able to treat him with chiropractic adjustments and laser therapy. He's gone on a motorcycle trip, so we're very happy that the treatment worked for him so that he can enjoy his trip. But that's another type of care that we've done recently here in the clinic. Let's see, what else? TMJ. Sometimes we do adjustments to the TMJ joint, that's the jaw joint, and we've had good success with that using the activator, which is an instrument to adjust the joint into a better position. It reminds me of one of my patients. He's moved to Winnipeg now, but I met him. He was the clerk at a liquor store, and I went in there to purchase a certain type of liquor for my father-in-law, who likes this rusty nail drink. And then I had to get this ingredient, Drambuie, and I was looking for it, and he came over to give me a hand. And then he said, "Oh, aren't you the chiropractor in Kelowna?" And I said, "Yeah." And he said, "Can you guys do anything for jaw pain? Because I've had this jaw pain for quite some time." And I said to him, "Yeah, come on into the clinic. I'll do an assessment. We'll see what's causing that jaw pain." As I assessed his jaw, it kind of deviated off to the side and went around the disc that was kind of binding between the mandible and the temporal bones up here. And so we started with adjustments. We adjusted the alignment of the TMJ joint, improved the function of the joint, and that really helped him to be able to open and close properly with more of a smooth movement, more of a linear movement, opening and closing, and then going side to side. So it made a huge difference for him. He actually left us a testimonial before he moved to Winnipeg. So we see a variety of different conditions here in the clinic. Some of my younger patients, they're thinking of chiropractic as a career, and I like to share with them some of these stories and encourage them to get into chiropractic because it is so powerful as a profession. You know, when you do adjustments, it can make a huge difference in someone's life in a short period of time. And I think that's kind of the benefit of chiropractic is how fast it works, and it works with the body to kind of realign the body, to improve the function of the body with an inside-out approach, one that's like enhancing the body's function. So really great philosophy behind chiropractic. I encourage my patients to adopt healthier lifestyles. Some of those lifestyles are eating habits, exercise levels, posture. I did a webinar this week on it was called Desktop Job Survival, and so there's a recording here on YouTube. I was talking about ergonomics at the desk station, so when you're sitting at your desk, how you should sit, and I was talking about having your arms at the right level, having your monitors at the right height. So that was a really good webinar, and I gave the participants some stretches to do while they're at work. I encouraged them to switch positions from a seated to a standing position, how to set their chair the right height. So really good tips there at that webinar as well. We do bill directly to insurance, so if you do have insurance, including ICBC, we bill directly to insurance like Canada Life, Sun Life, Manulife. So we deal with about 25 different insurance companies here. We do direct billing. You don't need a doctor referral to come and see us. That's a great thing. We're primary healthcare as well, so we can assess and diagnose and then do the treatment. Sometimes people are scared. I've had a few people recently that have never been to a chiropractor before. They are new patients, and they were saying, what's it going to feel like? I'm a little bit nervous, and that's normal too. It is normal to be nervous about your first treatment. And after the first treatment, most people say, I don't know why I didn't do this sooner, because it feels really good, and I was kind of worrying about nothing. So very gentle and effective care when we do the adjustments. I put a link in the chat here on YouTube. If you want to book an appointment, you can click on that link. It'll take you right to our site, and then click new patient appointment. I'm going to just show you. I'll try and bring my tab over for you here. Yeah, it's going to work on YouTube. So here's my tab of the clinic website, and what you're going to do is just click on this book now button. If you're new, click right here. If you're returning, you can click here, and that's a very good way to just simply book an appointment. First name, last name, email address, and mobile number. Pick a time, and you're good to go. There's usually one new patient appointment available every day. That's one of the things I tell my staff, is just make sure there's one space for somebody who's in a crisis and needs help immediately. So we keep one appointment time for new patients every day. So you can get a same day or a next day appointment. We are open 7 days a week, including holidays. So if you're looking for a chiropractor that's open weekends or holidays or later in the evening, we're open till 7, Tuesdays and Thursdays, then we're the right clinic for you. And so I want to thank you guys for joining me today here on YouTube and on Instagram. If you do have any questions, you're watching the recording, please type them in the chat or type them in the comments or DM me here on Instagram, and I'd be happy to help you.